Hello, I'm Tony DeMaria, the editor of JACC, here with highlights from the September 18th issue of our journal. The first study I'd like to tell you about is the so-called UPBEAT study, and this is a study in about 100 patients with coronary artery disease and depression to see if exercise compared with antidepressive medications could be effective in reducing the psychological changes and biomarkers in these patients. And so the patients were divided into three groups, a group that received exercise for about 3 months, a group of patients who were put on antidepressive drugs, and a group of patients on placebo. The standard endpoints that were looked at were metrics for depression, specifically the Hamilton score, as well as a variety of biomarkers, the most important of which was heart rate variability. What was found was very interesting, that exercise was the equivalent of medications in terms of reducing the depression score, and both exercise and medications were superior to placebo. Now, heart rate variability was also improved. So this study really raises the question. We have modalities, simple modalities like exercise training, that can reduce depression in coronary patients. Can this reduce events? Because previous studies with medications have really not yielded very positive results. Now, we have an interesting article in the September 18th issue of JACC that deals with the prognostic value of renal artery calcification, obviously determined by computed tomography. And it's been known for some time that in patients with renal disease or diabetes, that renal artery calcification was a prognostic factor, but it hasn't been known in the general population. So this is 4,000 patients without definite evidence of cardiovascular disease undergoing total body computed tomography. And in those patients, what was found was that the presence of renal artery calcification increased the hazard ratio for total mortality by about 60%. Now, if you factored out the presence of calcification in other vascular beds, the hazard ratio went down to about 40%. Nevertheless, still very significant. It was also determined that this was not related to the presence of hypertension, which of course would be an obvious question. So frankly, it's not clear to me how many patients might be undergoing some radiologic procedure in which renal artery calcification would be detected, but it does appear quite clear that the presence of renal artery calcification is a significant prognostic marker, even in patients without evident cardiovascular disease. And light chain amyloidosis is not a very common disease, but it commonly does affect the cardiovascular system. And so we have an interesting study in JACC that asked the question of whether a sophisticated evaluation of myocardial performance, left ventricular myocardial performance, could be a prognostic value in these light chain amyloid patients. So they did manage to study about 200 patients with known or suspected disorder. And the specific measure of myocardial performance was strain, longitudinal strain, or a global two-dimensional strain score from the longitudinal perspective of the myocardium. And what was found was that, in fact, both the longitudinal strain and especially the global two-dimensional longitudinal strain score were of great prognostic significance in overall events. And in fact, these strain measurements were better than ejection fraction and additive to the use of other markers such as BNP or troponin or even clinical factors. So a role for echocardiography, the authors of this study suggest that a global strain may be the most important prognostic measure in these light chain amyloid patients in whom a number of therapeutic modalities are becoming available, some drugs, and even the consideration of cardiac transplantation. So again, in this issue of JACC, some clinically actionable types of new information. For Inside JACC, I'm Tony DeMaria.